Chapter 7. Marijuana Patients Battle for a Kidney Transplant. We sat down with a medical marijuana patient who is fighting a battle with both her health and her healthcare provider.
My name is Amy Valerie Nicole Montano. I'm from Vacaville, California, and I'm 44 years old.
Amy has endured numerous surgical procedures over the span of her challenging life.
I had a kidney transplant in December 4th, 1987, one cadaver kidney. I had half of my bladder removed. I've had my intestines reconstructed as a child. I've had C-section, CAPD, which is continual ambulatory peritoneal dialysis. This is my third time, 2 times before I got my transplant, and then this is the current one. What else have I had? I've had my gallbladder removed. I've had my kidneys removed. They took those out 2 years into the dialysis beginning.
Throughout Amy's life, doctors have prescribed dozens of medications for her, some of which have caused her great harm.
With the transplant, I was on Amiran, cyclosporin, and prednisone. Those are triple therapy steroids. And over 7 years, they started doing severe damage to my body. I started first with heel spurs and plantar fasciitis in my feet. Then I started getting joint pain. And then I find out I have bilateral nerve damage and arthritis. So that was caused by the medication. It took them over 7 years to even acknowledge that that was being caused by those medications. And I went from 130 pounds to 230 pounds in just that short time.
After receiving prescription drugs for 7 years, Amy's insurance providers, Medi-Cal and Kaiser Insurance, told her that she was no longer eligible to receive drug coverage, forcing her to pay out of pocket in order to remain on the prescription medications. This left Amy in a dire situation, unable to pay for the expensive pharmaceutical drugs and in need of an alternative.
So $500 for one medication I couldn't afford, and I had to wean myself off the medications solely using medical marijuana. I was able not only to get off all medications, but to be able to live 14 years longer just with one cadaver kidney, which is unheard of.
Amy is one of only 10 patients in the United States to ever live as long as 14 years on just one cadaver kidney. Amazingly, and against her doctor's wishes, the only treatment she used during that time was medical marijuana. Today, more than 20 years after her first transplant, Amy is in severe need of another kidney transplant operation. She went into her medical providers at the University of California, San Francisco to ask if she could be put on the transplant list.
And now they're telling me I can't get a kidney transplant because I smoke marijuana for pain, medical marijuana for pain. I've done that the whole time. It's documented in every medical record that I have, but yet this is their way of doing things, just because of medical marijuana.
Amy is a legal medical marijuana patient by California state laws, yet she is unable to be put on a transplant list due to her use of medical marijuana. Because the kidneys are responsible for the filtering and removal of waste in the human body, people without them must do the work for the kidneys manually. Amy is forced every day to go through a procedure known as CAPD, or continuous ambulatory peritoneal dialysis.
This is my dialysis. I have to drain this into my belly, connected to this tube. First I drain out into this bag, and that ends up being, I'm putting in 2,000 cc's, right? 2,000 of this, and by the time I take it out, it's almost 3,000. So that extra weight is sitting in my belly up to 10 hours on my back and on my joints for 10 hours. And I have to do this 3 times a day for the rest of my life because I cannot get a kidney. and I cannot get on the list because I smoke marijuana. Even though they know the whole time what it's done for me, what it's helped me to overcome, I still not am allowed to get a kidney. And it's just not fair. I mean, as it is, with the last kidney, I was able to have a 21-year-old daughter when I was told I wouldn't live to age 13. And at 13, they told me I'd never have a kid. So I've come along amazingly, being 12 years on almost 14 years on no medication, solely using marijuana, and being a walking miracle and being part of the study, but yet I can't get a kidney transplant. That's not right in America.
Across the United States, transplant patients like Amy are being discriminated against for their use of medical marijuana. Even though studies have shown that there is no medically logical reason to assume cannabis use would be harmful for kidney transplant patients.
I am living proof that medical marijuana works. After years of depression, years of chronic pain, nerve damage, joint pain, I'm living proof that it works. I went from not being able to walk, not being able to leave my apartment, not being able to work, not being able to move, and have a decent conversation without being in pain and suffering, to being a normally functioning person.
To help one of the thousands of patients waiting for a kidney transplant in America like Amy Montana, visit the National Kidney Foundation at www.kidney.org.